Can you hear me? Okay. Good morning, everyone. Yeah, they can probably hear us in the other room, and they'll come in and throw something at me. I'm Jennifer Marvin. Hello. For those of you who are therapists that need CEUs every 2 years, at the end of the presentation, go over and see Sarah running the camera, and she'll give you a piece of paper, and we need to put your names and your license number.
Name, license number, and email.
And email. Name, license number, and email, so you can get your certificate for your 2 CEUs. So I'm not sure that Dr. David needs a big introduction, but this is Dr. David Baker-Hargrove. He's also the co-owner of Two Spirits with John, right?
Robert.
With Robert. I know, I do that all the time. I always call him John for some reason. No more Johns in your life, right?
Right.
Okay.
No more Johns.
Okay, so with Robert, his husband, and so he's going to give his presentation this morning, and I hope you all enjoy it. So without further ado, Dr. David.
Thank you. So what's a conference without a little AV emergency, right? So I couldn't get the projector hooked up because the laptop and the projector doesn't match. So we're going to wing it, and oh wow, these are really hot. We're going to wing it, and you're just going to have to look very closely at the screens. Also, Oh, I'm sorry, I thought someone was talking to me. I'm going to go through some of these slides very quickly. So I actually can provide this course as a 6-hour CE training. So I'm trying to condense it down to just a little under 2 hours. So some of the slides I may go through very quickly. If you want to get a PDF copy of the slides upon completion of the presentation, just come up and get a card from me. You can email me. I'll send them to you. Especially if you are a behavioral health professional and you might want to have them for future reference, it's certainly okay. I don't have any problem doing that. So onward we go. And so what we're going to talk about today is I'm going to try to give you a little bit of my professional bio and why am I here giving this presentation, and talking about some cultural terms in the trans and gender nonconforming community. Talk about some of the experience of being transgender, and we'll talk about some of the medical treatment pipeline issues, and also review some of the behavioral health roles that behavioral health providers play in providing transgender health. And then talking about other providers and other kinds of medical health issues that we just need to be aware of. And then we'll do some Q&A. And then big thank you at the end. But what I would like to tell you is that if you have a question while I'm speaking, please feel free to just jump in. Because I may say something. I've actually been giving this presentation for almost 10 years. I've given it probably over 100 times. There are lots of things that I've forgotten that I know. And if you ask me the question, then that might remind me about something. And I promise you won't throw me off my game because I'm just very used to doing the presentation. So please feel free to jump in, because the reality is that I could be the most engaging and amazing speaker of all time, and I'm probably very close, but if we're going to sit here for 2 hours and you're going to hear nothing but my voice, we're all going to be asleep before we get to lunch. So please feel free to jump in and make the conversation happen between us. So all presentations begin with a picture of me. So how am I here? So just give you a little background first on Two Spirit Health Services. Two Spirit Health Services is Central Florida's LGBT health center. We provide comprehensive health and wellness services for the LGBT community and our allies. We have a comprehensive medical family practice program where we provide primary care and family practice for all members of our community, also transgender health, disease management. Anything that you would go to a community health center for medical reasons, you can come to us. It's just that our focus is specifically focused on the LGBT community. We also have a large behavioral health clinic. We have 6 counselors and 1 psychiatrist. We also have adoption services. We have a patient care center where we provide for ancillary needs and wellness and connecting our patients to other services that maybe we don't provide in-house. And then we also have a spa where we provide aesthetic services, which really started as just laser hair removal for trans women, and then it kind of expanded into a full range of aesthetic services, and we also do fillers and injections and those kinds of things. So we are a comprehensive health center, and we draw patients from not only all over the state of Florida, but also the United States and beyond as well. Because as you probably well know, it's very difficult for people to find, especially in the transgender community, competent transgender health services. So how did it happen? Well, I'm a psychologist by training, and I have been working in this community for about 22 years. And I started out, I was approached by a client who was wishing to transition back in 1998. And if you know anything about, if you remember, how many people remember 1998? Anyone? Anyone? Okay. So the world was very different then in terms of technology. Smartphones didn't exist. The internet. Anyone remember Alta Vista? Alta Vista? Anyone? Anyone? Yeah. So we didn't have Google. We didn't have social media, and really, the internet really only existed for the proliferation of porn, right? So, yes. So, and it still does, but there's so much more now than there was. So I had a client approach me about transitioning, and I knew absolutely nothing about the process or how to help this person or what we would even, where would we even get started? I don't even know. So, and there was not really any way to find out a lot of that information either. There wasn't a lot of published work, and it was very hard to find anyway because I just couldn't go to Google, which I now call the Oracle, because 4,000 years of recorded history right here, right here. 4,000 years of recorded history, and what do we do with it? We look at videos of cats and we complain. But there's actually a lot of information that can be found there, and back in 1998, that didn't exist. So I was trying to figure it out, and we really, this client and I, we legitimately made it up as we went along. And we made probably a ton of mistakes along the way in trying to figure out how to help a person transition successfully. I was very, very lucky to find a gynecologist here locally who had read the WPATH standards, and I just happened to be, like, it was a gay Jesus moment. What I call gay Jesus moment is this serendipitous stuff that happens that kind of makes things all go the way that they're supposed to, because I think that because there is a gay Jesus and they are non-binary and their pronouns are they, them, their. And so, and this was a gay Jesus moment that I just happened to run into this gynecologist, and she goes, "Oh yeah, I've read the WPATH. I know how to do HRT. I'm cool with it." And so that really kind of started an enduring relationship that lasted almost 10 years up until the time when I had opened up the medical clinic at Two Spirit Health. So then it just kind of went from there, and I never really expected to be to specialize in transgender health. I never really expected to be the transgender therapist. But then just things started to snowball, and then when in 2008, when social media caught on, I mean, people just started coming, and I actually, so at about 2010, I stopped counting how many transgender folks I had worked with in the therapeutic setting, and that number was at 1,000. And that was 9 years ago. So, and now we have about 46% of our clients are, who come to the clinic for services, whether it be medical or behavioral health, are somewhere on the transgender spectrum. So we are constantly looking at how we stay on the cutting edge of working with this community, and how we can provide excellent cutting edge services. You know, one of the other things, and also just kind of looking at the future trends, one of the things that we've certainly noticed is that when I first started working in transgender health, the average client, so number one, the average client was male to female, and they were 40 to 45 years old. Now our average client is under the age of 18, and most of them identify as non-binary, but there are certainly a lot more female to male clients than there certainly were in the beginning of my work. And so let's get on with that. So first of all, I think it's really important that we, and if y'all can see this, just peer up really close. How many people remember like 13-inch televisions? 13-inch televisions, anyone, anyone? Yeah. If you had to like look really close, this is kind of that. We're gonna kind of, this is kind of that. So I think it's really important that, you know, to really understand the essence of culture, you really have to understand the language. And, you know, so for, how many people here speak a language that's other than English? Okay, so not very many, okay. So, but for those of you who do, you understand that sometimes there are things that don't translate very well, and it's a cultural thing. You say a word, and when you're familiar with that culture, you understand it, but if you try to explain it in another language, somehow it doesn't always translate well. And so that's because language has such a cultural component to it. And so I think it's very important to at least be able to understand and identify some of the terms that are used. And in the transgender community, the language is ever evolving. So the language that we use today and the common terms and the things that are expressed between members of the community and people who speak the language are very different than they were 4 years ago. For example, you know, 4 or 5 years ago, we didn't even really talk about a transgender spectrum. We didn't even really talk about the possibility of binary. You know, when we were talking about the trans community, we were still very much talking about the binary. You start here and you go here, and there's nothing in the middle. And so now the language has evolved to where we're talking about a spectrum. And so that's actually still kind of difficult for some people, even within our community, to kind of get their mind around. And so it's very evolving. But I'll run through this pretty quickly. And so some of the more common terms that you might hear a lot are MTF, which is male to female, FTM, which is female to male, HRT, which is very important in treatment community, hormone replacement therapy. So since I've made this presentation, I have some of the language has become archaic, and I've left it up there because I wanted you to see how quickly language changes and how things that are in common use can become archaic. And one of those is the term SRS, which stands for sexual reassignment surgery. That was a commonly used term until about 5 or 6 years ago, when we started to make the cultural shift in the language from being about sexuality or centered on sexuality to really more about gender. And so now we're really, when we're talking about the experience of trans folks, we're really focusing on the gender aspect rather than the sexual aspect, because really it was confusing from the first part when we first started to talk about and identify, especially as a professional community, talking about and identifying trans folks. It was always connected to some level of sexuality, and that's really not accurate. It's not about sexuality, it's about gender. So cisgendered is a term that is also fairly new, probably about 8 or 9 years old, maybe a little less, and it simply refers to someone who is not trans. So people who feel aligned with the identity that they were assigned at birth. And then trans, I think, is probably one of the most common abbreviated terms for people in the community. TG, I think, is used less so. TS, also archaic, because that stood for transsexual. And we don't talk about our community in terms of sexuality anymore. It's more about gender. And then also archaic is the term RG, or real girl. That was a term that was used quite frequently, probably 10 or more years ago, but has been abandoned because it was pejorative. It was really kind of self-loathing, because if you are a trans woman, to say that somebody else who was assigned female at birth is a real girl, that diminishes your value. So, a cross-dresser is someone who wears clothes of another gender or sex. But of course, very interesting caveat here is that when we talk about cross-dressers or the cross-dressing community, we are really only referring to people who were assigned male at birth who wear female clothing. Because people who were assigned female at birth and wear men's clothing are not considered cross-dressers. Does anyone know why? Anyone would like to take a guess? Because it's not seemed diminishing for any human being to wear men's clothing. The transgender experience is all about sexism, and it's all focused on how women are still second-class citizens in our society. So that is the problem that we have in our society with really getting our minds around, where society in general, getting their minds around the transgender experience. It's really inherently about sexism. Because there just isn't a problem with, and we don't consider people who were assigned female at birth to wear men's clothing. We don't label them as cross-dressers. But here's the other interesting thing too, and if anyone in the audience has some up-to-date information about this, I would certainly appreciate your input. So, certainly when I was talking about when I first started working in transgender health, the average age of the patients that I was working with were in their mid-40s. They were male to female. cross-dressing was a very common threshold experience for this cohort of people, because what they thought at first was that they were trying to deny their transgender, I'm not trans, I'm not trans, I'm not trans, I'm not trans. But there would be this persistent need to adopt a female persona. And so kind of the toe in the water for a lot of folks was to be a member of the cross-dressing community, join cross-dressing groups, and kind of explore that. And then what a lot of trans folks would tell me in therapy sessions was, I would go to these meetings and I just, it felt okay at first, and then I would feel like, okay, I don't really fit in. This is not me. I need something more than just one Saturday night a month putting on a dress and going to a potluck. That's just not who I am. I need to really just express myself all the time. And so over the years, I've really felt more and more and more that cross-dressing was more of a threshold experience than an actual kind of like, this is the ending point. There's a clear difference between being a cross-dresser and being transgender. I've met a lot of people who have been members of the cross-dressing community for many, 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 many years. And after talking with them, it became very apparent to me why they kind of got stopped right there. There was issues in their lives that they felt like they would have to make a trade-off. Like, I'm afraid that I'll lose my marriage, or my kids won't like me anymore. And not really feeling courageous enough to take that step forward. They just kind of landed here, and that's where they stayed. My feeling is, and so if any of you have some more, up-to-date experience that you would like to share, I appreciate that. But my feeling is that as people come out younger and younger and younger and younger, I actually think that the cross-dressing experience will start to diminish, if not altogether disappear, because that won't be a stage that people will have to go through in their own self-acceptance. Anyone comment on that feeling? Okay. Yep. Yeah, great. Thank you for that. Yeah. Right. Yeah. Excellent. Yes. Yes, you can, but by and large, general society does not. General society does not use, the term cross-dressing is typically not used in conjunction with someone assigned female at birth wearing what we would consider to be typical male clothing. It's just the term isn't used. It's a society cultural kind of approach rather than I'm not making some sort of edict. you know, yeah. Yes. Which one? Which? What? Oh yeah, I would definitely say that there's also regional influences too on attitudes. That definitely comes into play. People, if you go to certain areas of the West Coast or the Northeast, there's going to be there's a lot more progressive thinking in terms of clothing and mannerisms that conform or not conform to gender norms than you would in Alabama. Um, Well, and I just my personal opinion on that is that to me, that struck me as people trying to um, blame her for trying to appropriate male culture to take her power away. That's just kind of how it hit me. That's just my opinion on that. Just how it. Yeah. So, oh yes. I don't know. I don't know. It just kind of came. Though it just. I don't know. It's just the slides just kind of evolved the way they did. Oh yeah, yeah. I don't. Interesting thought. I'll take a look at that because I see this as kind of like a living document that kind of has to keep up and all the time and be looking at that. So I certainly accept feedback from people who are participating because I never thought about it. Yeah.
I think to your point, the sort of the rise of gender nonconformity and non-binary as accepting as as more accepting as it becomes in society, it kind of reduces that vision of what cross-dressing is. Like if I'm not uh, I'm not always a positive thinker, but if in the future we're going to see clothing that's non-gendered, if society stops seeing men's clothing and women's clothing, then the idea of cross-dressing in general just kind of
It
becomes
kind of loses its
non-existent. Yeah.
emotional value. Yes. So, just to kind of move through here a little quicker, gender identity is a person's sense of being masculine, feminine, or other gendered. Um, Newer terms that again tend to assess more accurately people's existence is AMAB and AFAB. AMAB is assigned male at birth. AFAB is assigned female at birth. So again, it's really moving away from the whole concept of born a boy or born a woman. It's what you were assigned at birth. So interesting, I think an interesting tidbit of knowledge for me that I didn't know until I really started to explore this is how is your gender defined from the get-go? How's your gender defined? Right. And tell me more about that. How is that determination made? Ex- that's Oh yeah, absolutely. So Yes, and so I like where you're all going with this. Just to kind of build on that for a minute, just consider this. So before sonograms become more popular, the general rule of thumb is that a physician who you as a human being only know for a few minutes of your life, who you will never remember meeting, looks between your legs when you're born and makes a proclamation about your identity that will last and endure your whole entire life. And actually, it still kind of happens. It's just now through a sonogram. So now it's even less personal. That this person decides your fate, and that identity perseveres and endures throughout your whole entire life. And you are expected to behave and act a certain way based upon what this person says. A person that you will probably never really meet, and you certainly won't ever remember. Isn't that kind of freaky when you think about that? Well, sure, because it's well, sure, because it starts this whole pipeline of expectation, and this is how it goes. You know, like um, they've since changed the way that they do things at Target. Thank God, that's why you love Target. Target. But you know, there was one point before I had a child, because I have a child now who's 5, and but before I had a child, I somehow got lost in the Target, and I went down the kids' bedroom aisle, and at that point I was horrified by what I found, because on this side of the aisle, the backboard was all pink, and the decorations were all unicorns and rainbows and princesses, and then on this aisle was all navy blue, and it was all sports motif. And it's just kind of weird because I thought to myself at the time, well, what if I don't like any of those things? And yes, yeah, right. So great segue, because when my husband and I were expecting our child, we did not know what the assigned gender was going to be, and we did not want to know until the child was born. And so we decided that we were going to do the nursery in neutral colors. And at one point, I said to him, I was laying on the couch, and he was sitting in the chair, we were watching TV, and I lifted my head up and I go, "Hey, can we do the nursery in poo?" And he's like, "What do you mean?" As in Winnie the. And because I thought that Winnie the Pooh would be gender neutral, and so we could do the colors in mustard and sage, and it would all be very nice. And guess how difficult it is to find baby products that are not pink or blue. So this is my rant, at least one of them. So a bottle brush, a bottle brush. How does a bottle brush have to have any kind of gender attached to it? We could not find a bottle brush that was not pink or blue. So one time in one of the umpteen million Bye Bye Babies that I was in, there was a green one all the way at the top of the display stand, and I made the salesperson go up there and get it for me, because I'm like, I'm not going to have a pink or a blue bottle brush, because that's an insult, that every single thing has to be gendered. So, so interesting PS to this too is that I was very adamant that I didn't want to impose any gender norms or stereotypes on my child. So our child ended up being assigned female at birth, and it is amazing how many parents that I've had tell me over the years, you know, how do you know that my child is trans? Because kids don't know what they want. Oh my holy God. That girl's gender identity was so rock solid by the time that she was 2 years old. I couldn't even stand, and I did nothing to encourage it. And she is the biggest girly girl that you would ever want to see in your life. The only difference is that she'll also kick your ass. Um, but you know, it became very, I was really thankful for the opportunity to realize how quickly children really coalesce their gender identity, and that as adults we are delusional to think that that's not real. Yes. that's a great clarification. And I think my trip up there is that this is typically designed for health professionals. So yeah, but that's a great point. That's a great point because everybody here who's not a health professional needs to hear that. So thank you very much for that. Yeah, yeah, yeah. Thank you for that. Okay, so and then we're talking about different words that are used back and forth about describing gender, normative, gender nonconforming, as a person who either by nature or choice does not conform to gender-based expectations of society. And then also non-binary, which is a term that is more and more discussed, and more. I think that the most important thing to know about people who identify as non-binary is that non-binary is a very individual subjective experience, and so it's like one person does not make in itself a case study on what the non-binary experience is about. Everyone experiences that in their own way, and I think it's very evolving too, because for a lot of people, they may not necessarily know that they've been non-binary for a lot of their lives because they didn't have the language to really understand that. That's certainly something that happened for me. I realized in the last year and a half or so that non-binary is a better experience to describe my inner experience. And even though it's very unlikely that I will never be less male presenting than something like this, although I really have a great heel collection, as my staff can admit to, I have a great heel collection. But for the most part, I'm about 95% male presenting, and that's probably not going to change. For me, non-binary is something that is really more about my inner experience and my energy, and the way that I kind of define that inside, and that could be completely different for another person. So it's not something that you can really kind of throw a dart at and go, oh, this is what it's like. But that's kind of human experience, anyway, is that we all kind of are at least individual to some degree. So an intersex condition is a condition in which a person is born with what we call atypical genitalia. And so the issue with that is that there are, for people who are intersex, they often experience some of the same sociological and psychological issues as people who are trans. So we were talking a little bit ago about how their gender is identified when they're born. So if someone is born with atypical genitalia, there has typically in the past been a compelling need, for lack of a better term. I know there's a better word for that, but I can't think of it right now. But a compelling need for medical science to fix what's wrong and to do some sort of corrective surgery to have this person have more what we would identify as typical genitalia. So the problem is that, as we well know already, genitalia does not necessarily equate to gender identity. And so, and that for most people who do have an intersex condition that have atypical genitalia, the problem is that medical science really can only do essentially one type of surgery, and that is to make that genitalia female. As I said when I was providing this lecture to the VA medical services team, I got dinged on the evaluation because I made a comment that they said, "Oh, he's so crude." But I thought it was just very natural, and I said, well, because in medical science nowadays it's easier to build a hole than it is a pole, and because we don't have the medical science to be able to actually make that work well, and so that so what happens is that very often the corrective surgery is made female, but then when that person reaches puberty, their gender identity, or even sometimes before, their gender identity doesn't necessarily aligned with the corrective surgery that was done, or the way that the family has been instructed to raise the gender norms to raise this child. And so that can create its own issues as well. The other thing that, yes? Well, and thank you for sharing that. Yes. Right. Right. Yes. Absolutely. Yes. That's totally true. And the language, the language. Yeah. 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 Yes. Oh, yes. Which made it even worse. Absolutely. Yes. Um, yeah. So what I was going to say, see, I told you you wouldn't throw me off. So what I was going to say was that I've met um, adults with intersex conditions who were never told that they were born with an intersex condition, that it was a big like hush family secret. And so you can imagine as well. So there's no right. Yeah. Oh, so that's not even really like that's not even healthy. Then you didn't get it the right way. Yeah. Yes. Yeah. And my, I think it varies. It varies by the by the attending physician, and how and what their comfort level is with this sort of thing, because it's that and that has a big influence on. Hmm. Mm-hmm. Right. Okay. Well, thank you all for sharing. So, so transphobia is really about the irrational fear of people who are gender. Yes. Yeah. Oh yeah, and it's like almost infinitesimal than the size different. Yeah, yeah. Oh yes. Oh yeah. I so very good point. Like that could be a whole other presentation because there's so much to talk about in that regards. It's much more complex than people would know. So thank you very much for sharing that. Okay, and so then the other thing is that it's just important to realize is that we all LGBT, 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 and everybody thinks that we're all kumbaya under the same umbrella. Foolish mortal. So it's like we're not, and a lot of it has to do with internalized stigma about ourselves and our identities. So we point the finger at each other, we get on each other because we don't completely understand ourselves and we feel at odds with our own society and we internalize that and then it all comes out back as anger. It's psychology kind of 101, but the unfortunate thing is that it presents its own problem in the terms of how we get along and how we build community together and how we bridge understanding with each other. Um, so, I know they said in the last presentation, sexual orientation versus gender identity, and someone said this very common phrase that I've heard a lot is gender identity is who you go to bed as, and sexual orientation is who you go to bed with. Yes, and so it's kind of like the best way to describe it. Okay, so onward. Um, what I had done over the years in working with so many clients, and so what I'm going to focus on here for the majority of this presentation is really kind of talking more about the binary trans experience, and that's really kind of how this is really kind of how this presentation is based on, and when appropriate, I might intersperse some non-binary stuff. But I will. The caveat is, by and large, the rest of this presentation really focuses on binary gender transition. So when working with so many clients, I started to look at, okay, what are the kinds of different psychological stages that people go through when they're really trying to get successfully through a transition. And so one of the things that I realized is that there's kind of a pre-acceptance phase, doing a lot of online research, looking at a lot of articles. Now, earlier we talked about how the internet is so much better now than it was in 1998, but be forewarned, there's still a lot of garbage out there and a lot of misinformation. And, and a lot of people consider themselves to be an expert on everything. And if you don't believe me, just open your Facebook page. So an expert on everything. And if you're a questioning person really trying to figure out who you are and your identity doesn't feel very much intact, this can be very hurtful and damaging as you get all of these very strong opinions about who you need to be, how you need to act, and what you need to do about it. And especially when you're trying to struggle with a lived experience that is at odds with society in general. So, online research is great, but it's really important, especially for your health providers, to help patients understand that you can't just take everything at face value. So we talked about the cross-dressing as being a threshold experience, certainly in the past where a lot of the work that I was doing. Also cross-dressing in secret. I would encounter people would talk to me about situations where they would do what they would call the big purge, where they would have this, cache, I don't know, how's the right word to pronounce that? C-A-C-H-E, I don't know, anybody? But they would have of women's clothing, and then they would, that would be hidden from everybody, and then they would go, I'm never going to do this again, I'm never going to do it, and then they throw it all away. Only a couple of months later that you got to go back out to the store and you got to start buying stuff again. And so not only is it hard on your psyche, but it's expensive. So yes, it's a lot. So dealing with a lot of guilt and shame. And then really kind of the coming out phase is living out online. So now in my role as CEO at Two-Spirit, I don't really see patients every day like I used to, but I ask the behavioral, but in my experience when I was working with patients every day, what I would sit down and I would say, okay, so tell me about your coming out. Have you told the people who are important to you? Have you come out to them? Oh yeah, I'm out to everybody. Everybody knows about me. It's all really good. And I feel really comfortable, and all my relationships are good. And then I would find out upon further explanation that we were only talking about people on the internet and not people in real life. And again, that creates a barrier to your authenticity when you've kind of let yourself believe that you have really taken that big plunge about coming out to people who are important to you. And that's always been a guideline for me, is that I always wanted people, as like part of being in your authentic self is coming out to people who are important to you. You don't have to come out to everybody, and that's where people get confused. Coming out means, well, how many people do I have? Yes. Yeah, and really, it's something that people have to kind of come into in their own, space and time, kind of get used to. But it really is important to authenticity that we connect, in real time with people about our identities and our stories. Coming out to others, I think, obviously seeking a therapist, I think, is a great amount of help. Unfortunately, I feel like that because of some of the WPATH standards have kind of been largely misinterpreted to kind of put us in the behavioral health profession as kind of a gatekeeper to medical services. And, you know, that's unfortunate because there's so much more to what we do that's really not about a letter. It's really about grappling with these very complex emotional and psychological issues that, you know, we're really trying to align and authenticate our identity when it doesn't, when the society around us is telling us that what you think and feel is not real and it's not accurate. And so there's so much more that a therapist can do. And so I think there's still a lot of potential for depression and anxiety and shame and guilt. And then really starting with the transition phase. And that's, you know, developing a social transition plan. I think, again, is a key element to really living in your authentic self, is that you have to have a plan on how you're going to be you in a world that may sometimes kind of trying to knock you upside the head, metaphorically. How you're going to be you. How are you going to work? How are you going to interact? How are you going to build a network? How are you going to do all of the things that people need to do? But do that where you, at least to some degree, where you can be comfortable in your own skin. And so that is really about developing that social plan or social transition plan, and then instituting hormone replacement therapy. I have always told people that if they're, again, we're talking about really strictly the binary here, is that if you're transitioning, that really the first year after initiating HRT should really be the big transition phase. You know, that you're going to get probably most of the maximum benefit from HRT at somewhere between 9 months to a year. That's really the ideal time to start thinking about the legal transition, changing your name, changing your gender marker, making sure that you have prepared a transition plan for where you're working so that you can really at some point between 9 months and a year just fully actualize yourself in the gender that you're supposed to be, and really at that point start to get on with the rest of your life. What I have found is that people who are really considering themselves in the binary and they take too long to really affect that full legal transition, it can have lingering psychological impacts that can be problematic. And so it's just really important to be able to really come up with a plan and to do that. And it can be scary. It's such a scary process for so many people. There's so many things that you consider and that you mull over in your mind, and all of that is real. But it's, but self-actualizing for any human being does not come without its own cost. And so that's why it's so important. Yes. Absolutely. We get too focused on the medical piece, and I've thought for many years now, transition is 5% medical, 95% emotional and social. Because it's really not about, if it's really not about, let me back up. If we're really talking about this being about gender, then it's really focused on how we interact with the world and how the world interacts with us, how we're seen, because we want to be seen through that lens and so that's why it's so important. And we have to get, and it's a lot of, it is, I agree with you. Thank you for sharing that. It's a lot of work to get comfortable with it. So then the medical treatment line is an HRT. The medical doctor should feel comfortable with the introduction of hormones and titrating up to therapeutic levels. It's a lifetime of monitoring and balance. You know, one of the things that I have realized now, before when I didn't have a medical clinic and now that I have a medical clinic, is that, you know, I'm very familiar because I've worked in HIV health for almost as, you know, probably 25 years. And I'm very familiar with the concept of pill fatigue that people who have long-term survivors of HIV have, where they just get tired of taking medications. Never even occurred to me that pill fatigue would happen in the transgender community, where it's just sometimes just the medical responsibility just becomes too onerous. And I do think, along with, you know, there's always probably some psychological component to that, you know, that you're probably, you know, or your clients are, you're probably facing some sort of growth wall that they kind of have to work through. But that's, you know, having pill fatigue or even injection fatigue for trans men can be a really a key opportunity to see that there's probably a growth wall that you're experiencing that you might want to have to work through. So then major surgeries, not everybody who is trans-binary has major genital surgeries. It all depends on a lot of factors. For some people, it's a cost factor or an insurance coverage factor. For other people, again, the social experience of having people see you and interact with you and the gender that you really are is enough. And so it's not really so much about having the genitalia of that gender. It's really about having that experience of moving and interacting in society as such. So have you all seen this? But yes. Absolutely. Absolutely, yes. It's very individual. Yes, thank you for that. So y'all have seen this before, right? You know, which do you see, the young woman or the old lady? Perception is, you know, another kind of confound when we're talking about our community, because, you know, we are programmed, whether we like it or not, to allow our perception to dictate to us what we see in front of us and to size it up and put it into a box. The brain, not as opposed to the mind, but the brain likes to put things into boxes. They like to label things. The brain likes to label things. The biological part of our anatomy up here likes to put things into boxes, label them discreetly. You know, everything is either this or that. It's very, very concrete and knowable and understandable, and it's all based upon our past experience. And a lot of that has to do with perception. One of the things that we're working on, one of the paradigms that we're working on right now at Two-Spirit is how to affect facial feminization or facial masculinization through non-surgical methods and using fillers. Because our eyes, whether you realize it or not, will look at someone's face, and very subtle differences in that face, and we don't even know what they are, will register that person to you as being either male or female. And so so that's what we're studying now, is what are those subtle differences? What are the paradigms that we can be able to affect those changes through non-surgical methods? Because, I mean, just the expense and the recovery and all that stuff alone versus, you know, an hour and a half getting injectables versus 9 months in painful recovery from facial surgery is hugely different. But also, this is where the issue, perception is also where the issue of where the struggle for non-binary folks come in, is because, you know, a lot of times for presentations, or sometimes, you know, depending on how the non-binary person presents, we're still going to put them into a box of either male or female based upon what we see. And so that's why it's, you know, really important to recognize what our perceptions are telling us. So the mental health role is, you know, conducting the initial biopsychosocial assessment. We're still stuck in a medical model where we have to make a diagnosis of gender dysphoria. You know, the week before last, there was a big hullabaloo because the World Health Organization removed transgender as a mental illness, but that didn't change gender dysphoria. So in the United States, in the diagnostic, in the manual, the DSM, where we talk about all of the listing of mental disorders, transgender is not mentioned. It's not in there. It's been taken out. It was about, oh my gosh, when was version 5? Psychologist help me out. Oh no, more than that. DSM-5, when did that, I can't, 2012. So, so gender identity disorder, which was another name for being transgender, was taken out, and what was put in was gender dysphoria. So you're not mentally ill if you're transgender. You're mentally ill if you're transgender and you're upset about it. So, but we still have to make that diagnosis in order to get, in order to put the person into medical treatment. The diagnosis has to be made. So, you know, hopefully there will come a day where we won't have to worry about stuff like that. But yes. Oh yeah. Oh yeah. And you would be, or you would be, well, or maybe you wouldn't be shocked about how entrenched the medical service community is, especially the insurance companies, and you know what constitutes care versus what constitutes billable care versus what doesn't. And so this is one of those things that kind of throws them for a loop. Also, when cross medical care, like services that they classify as only being for females, or services that are only for males, that confuses the whole issue and it screws everything up, and it makes it hard for folks to get proper reimbursement. And just even so simple, like for instance, in the last couple years, there has been an increase in use of the HIV preventative called PrEP. Well, guess what? Western medicine knows nothing about preventative medical care. So the insurance companies we're struggling with how to a billable code for this, because we don't have any billable codes for preventive medical care. It's all about treatment, and it's making them crazy. And this is how entrenched they are into their own, into looking at their own reflection, is that they can't come out and open up their minds to, we all have to evolve. If we're going to get healthier as people, as a society, we have to evolve. Um, oh yeah. Oh yes. Absolutely. Thank you for that. So then, it's really important for the therapist to help the client assess for any barriers to a successful transition. If they're not, well, we talked about the living in authenticity, if they're having any issues about being stuck in their social transition, and really trying to problem solve and work through those so that they can move on. And then offer continuing assistance and provide consultation and evaluation for major surgeries, should the person decide at some point later that that's would be a good choice for them. And then the medical department, I've talked a little bit about the treating physician, but also it's really important to reaffirm with the patient that they understand the risks of HRT. It's good if you are a behavioral health person, or if you are a person receiving transgender health services. It's really important that you have a medical provider that can really assess help you understand all the risks, but also know what to do when the risks occur. And to be able to help you. One of the things that was evolving in medical practice that is not widely known, but certainly something that we have figured out at Two Spirit Health Services, and also how to deal with it, is that too much testosterone treatment can create a disorder in the blood, which makes the blood sluggish, and it interferes with circulation. And so the cure for that is a therapeutic blood draw. It's like you would go and you would give blood, but you can't use the blood because it's too high in iron, and so it just has to be disposed of. It is no, it's called ah cyto I can't think of it. Yes, the therapeutic blood draws. So right now we're in the process of interviewing a phlebotomist in order to do that, because the problem that we found is that One Blood doesn't want to take referrals from our patients because they can't use the blood, and so they figure it's a waste of their time. So, and that's because they don't understand the critical need that our trans men have in having this treatment being done. And so we're taking up on ourselves to manage that. But it's a very important. So interestingly, too, I recently had a conversation, and this person had no idea what he was explaining to me, but he was telling me a story about how he. So at the time, he had no idea what he was explaining to me, but he was telling me a story about how he had just recently had open heart surgery, and the surgeon was talking about how the heart muscles were like ripping apart in his body because the heart was trying to expand to compensate for his thick blood. And he had no idea what he was explaining to me at the time, but he had the surgery and it got corrected and everything, and so I was explaining to him, I was like, look, this is what you need to look out for, because this is not going to go away. But he'd never heard of that. And the surgeon who performed the open heart surgery on him was not aware that that condition existed. So we are in an evolving stage of medical science for our community, and it's really important that we're constantly looking at there's no longitudinal health studies on how we support and keep trans folks healthy throughout the lifespan. And so that's, it's definitely things that we have to stay on the cutting edge about. Nope. Nope. You just take a point of blood, and the system will reset itself. It's really freaky. But the system will reset itself. Now, that doesn't mean that you won't ever have to do it again, because you constantly have to have, so you may have to do it again at some point in the future. And what we don't know, because we don't have the longitudinal health studies, is like how many years, months, whatever are we talking before you may have to have it again. But it's really just drawing a point of blood. Yeah, yeah, exactly. Isn't that weird? Yeah. Oh, uh-huh. Yeah. So I just said this here about, I'm just very fascinated over the years more and more and more about gender oppression. Do I wear blue because I'm a boy, or am I a boy because I wear blue? How do we determine, is it pressure from society that determines our gender? Do we try to conform to make things easier on ourselves? It's kind of the chicken or the egg thing. But I always thought this was cute too, is that, the doorway here for men, like there's no, anybody can come through, and then for women, it's a complete certain figure. You only have to fit a certain type, and to be considered female, and that's it. There is no leeway there. Um, so why? So I talked a little bit about why assessment of dysphoria is important. It's really because medical science dictates it right now, and until we get a better way of being able to get people the treatment they need, we're kind of beholden to what medical science tells us we need to do. But the reality is, and I'm going to go through these real quick, is that when you're talking about the Diagnostic and Statistical Manual for for gender dysphoria, I mean, the language is very stereotypical. There's no, it's really sociological, it's rather than really anything else. The language is very stereotypical about our gender norms. So you can't see this very good, but this was if it was up here, it would be beautiful and you would love it. It's kind of it looks at the spectrums of, oh my gosh, in my old eyes. So like this looks at the different spectrums between biological sex and gender identity versus gender expression versus sexual orientation. And what I think is kind of the most interesting thing to point out on this slide is that, we're getting our head around, we talked about the spectrum of biological sex, we talk about the spectrum of gender of sexual orientation. But what I think is very interesting too is to really kind of identify the difference between gender identity and gender expression, because they're not necessarily the same thing. So like for me, for instance, so this is male over here and female over here on this side. So gender identity, I'd probably put myself about right here, a little bit more towards the center. But gender expression, I'd probably put myself a little bit over here, And I think that if I was probably 30 years younger, it would be different. But it's just because I have all these old patterns in my head, and I'm kind of like, and then I'm old, so I'm kind of like, I'm fine the way I am. I'm good. I'm tired of fighting internal battles. It's just too much work. Some of the emotional and physical and mental health challenges are, really, one of the things that I've noticed for folks is that there's a lot of kind of delayed development that we experience, and I think this is across the board for all of us LGBT folks, because really the reality is that when we feel divided from our society, especially as small children, we start to feel that division. We start to feel a gap in between us and the people. There becomes a little disconnect, and I think, and I imagine, and we put like a little brick wall, and the more that we kind of feel disconnected or at odds with our societies, that brick wall gets a little higher and higher and higher, and at some point we become in some way disconnected to our own consciousness. I feel like that amongst our community as a whole, we do have some sort of dissociation from our authenticity and our consciousness. And so what that happens is that it results in really delayed development, that we don't really get to fully develop in all of our emotionality and our emotional intelligence in the way that we could if we didn't have to fight that barrier that we've built. Also, preparing for puberty, it's a one thing to go through puberty when you're 16 or 14. I don't know. My daughter's only 5, so I don't know if puberty hits yet. 10. Oh my God, stop. And but imagine going through puberty when you're 35. I mean, it's a difficult situation to kind of to experience. And then dislike. So, show of hands, how many people 100% love every single part of your body, and you? What? Nobody? What? Nobody? Oh, come on. No. So actually, to be true, none of us completely like 100% every aspect of our body. And one of the big issues is that, again, with being in the binary trans, is that that can become very hyper obsessive about focusing on the things that you don't like about your body, especially something that feels inherently not your mental gender. And that can be very problematic. So we talked about the transitioning. For one of the big things, obviously, too, for binary transitioners is passing in stealth, and that is really trying to be able to, not be clocked in general public as being a trans person because maybe you have an atypical presentation, what we call atypical presentation, or as my husband, who has a fashion degree, calls it an atypical silhouette. So, which I just love that term. It's so, it's really kind of, it accurately describes the situation without being offensive. And and that can be problematic because, again, we have perceptions about what women should look like. Go back to the slide about the little curve out figure. Yes. Yes. Yes, yes. Yeah, it's really hard to love all of your skin that you're in. And then the problem is to not obsess about the parts that you don't like. You know, um, right. But that's not going to be true. Yeah, that so would not be true. Um, and then, also just being able to fortify people in managing difficult situations. There might always be a situation where you run into, and probably, especially after you've transitioned for a while, unexpectedly, that you're going to end up in a social situation where it's going to take you by surprise because someone's going to, give you a side eye, or they're going to give you a funny look, or somehow you're going to know that this random person has some sort of issue just by the fact of your presentation and your perception, and just really being able to manage that. And again, we were talking about earlier about being out. Being out doesn't mean that you have to be out to every single person. And so we have, I don't ever suggest to someone that you should go up to the 7-Eleven and go, well, the transgender would like $10 worth of gasoline, please. But we have to be, but it's important that we get comfortable enough that we can manage difficult situations, that they don't derail us and completely dismantle everything that we've worked so hard for. And that is not easy. It is a struggle, but it can be done. And I think that's where a therapist can provide such great support in that. And then facing the finances. You know, as I told clients for 20 plus years, it's not really that expensive to be gay. It can be more expensive to be trans. Although INC does kind of level the playing field a little bit, because that was a fashion joke. Okay, never mind. I won't tell that one again. So, because there's also a lot of the mythology in the trans community about how expensive it is and all of the costs and the hoops that you have to jump through. And while all of that is true, again, it's very important that we help clients understand that we don't let it rule you. And there is definitely, I've seen over the years, and part of the mythology about money and the expense is a deprivation relationship of being trans is too expensive and I can't afford it. And certainly for a lot of people that's true, but at the same time, I've had young college kids come into my office, they're going to school at UCF, they've just left home for the first time, they're working part-time, they come in and we have the conversation about them moving forward, they go get an HRT, they come back a year and a half later, and they've saved up the money for surgery. And that's because they made it a priority. And they didn't spend time wishing things could be different. They spent time making things different for themselves. And that can be the key, huh? Yeah, and that can be the key. The other thing is that once you feel like you've really kind of hit that fully transition mark, you've changed your name, you've changed your gender marker, you're living fully and completely in your authentic self, now what? Now what is the rest of your life? You have to kind of leave the whole kind of angsty transition experience behind and move on and be the person. And now, the reality is that you're a human being and that you have all of the human being issues that other human beings do, and it's really about, figuring out what you're going to do next. I remember, I kind of equate this in my mind to when I was working on my PhD, and when you're trying to get a dissertation, so I'll tell you this. So I've been to military boot camp, believe it or not, and in the Navy, 9 years. And but I've also had to push a dissertation through committee, and I know which one I'd do again, and it's not this one. So it consumes your life. It consumes your life. And so for the, see, you're picking up what I'm putting down. So for the 2.5 years or so that I was working on the dissertation, it was like everything. I ate, slept, blah, 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 dissertation, and it's frustrating, and I learned cuss words that I didn't even know existed. And then the day that I was going to that I was doing my final presentation to get conferred, so I walk into this really ominous-looking room where all of the committee's sitting there, the scene in Harry Potter where all of the Ministry of Magic, where they're all sitting up there in high spaces and Harry's sitting down here like this. It's kind of like that, and only worse. And so you got to present your dissertation, and then they ask you all these questions, which are stupid because they've all read your dissertation at least 50 times, and they know all the answers to the questions anyway. And so it's all, whatever. So then I was done, and I walked down the hall, and I was walking outside to kind of get a breath of fresh air. And my committee chair comes running down the hall immediately afterwards, and she's like, "Oh, I just want to be the first to congratulate you and call you Dr. Baker-Hargrove." Now what do I do? I had put all of this energy into this line in the sand. And once I got there, I was now convinced that I was going to drive off campus and I was going to get hit by a bus and die. Because I thought, I don't know what's next. That can happen for people who fully transition, is that they don't know what's next. And so that's why it's really important to help people understand, you got to think beyond. In the 70s, they did a lot of research with heart patients who had heart surgery, and they actually conducted a study that heart patients that were about ready to have open heart surgery, that had plans for what they were going to do and how they were going to live their lives, had a better chance of recovery than the patients who really didn't have a clear idea of what they were going to do after they recovered from surgery. So the same is true for this. You've got to have a plan for what happens next. So Also talking about family issues, oh my God, is it a phase? Is it real? I don't really know. I mean, how do we really know? All of these things. But really, what we're talking about here is it's really important to understand that these are people who are projecting their own fears onto this patient or this client, and so they don't understand. Like, for me, I knew I remember at the age of 4 thinking that I was different. And I didn't have the language for it. I didn't know what it was or what it meant. But I remember I was at day camp at the YMCA, and I was standing against the wall in the gym, and I was watching other little boys my age play with a basketball. I really don't know how, but it is clear as if it happened yesterday, and how, like, I had this kind of, I think, intelligent language at 4, but I thought, I am not like you, boys. I'm not like you. And I had no idea why, but I just knew that I was different. And I have talked to so many trans folks over the years who have come into my office in the beginning and said, and they could be in their 30s or 40s or 50s, and said, I never had any inkling when I was a child. And then somewhere down the line of transition, they will go, the other day, I remembered when I was over at my grandma's house and I found my aunt's doll in a closet, and I took it out and started playing with it, and my grandmother freaked out, and she took the doll away from me and said, that's a girl's toy. And she goes, and people would say, I wonder if that was like when I started to suppress my identity. So things like that happen a lot, and then we forget. Our life experiences, sometimes they don't stand out as being important until some point in the future we kind of connect back to it. And the whole point, I think the whole message is trying to get out to people is that I'm fine, and actually now I expect to be different, be better, because I know who I am. And who wouldn't love that? The other thing too, I think for us, for trans folks is that sometimes we have to define acceptance. And, because I think that we have a very clear idea a lot of times of what acceptance is. But, I'll tell you from my own experience, so I've lived most of my life as mostly in the gay male identity, and I'm still very comfortable with that, and that's fine. But, when I came out to my parents at 18, I kind of got okay, not exactly what I was expecting. I was expecting anything but that. And just kind of this kind of meh. And then we never talked about it. It was never something that was brought up, and it felt uncomfortable for me. Like, I can't talk about like my boyfriends or or pride or anything, and it just got really it just kind of went very much downhill for me. My relationship with my parents, even though they didn't know as much as I did because I was the one wrestling with it, and I had a lot of anger that I had to kind of deal with because I didn't feel like that they were accepting me, because I wanted them to march in my parade, and I wanted them to hey, tell all of their RV old friends that I'm sorry, I should have used the word senior. Tell all of their RV friends that, hey, I have a gay son and it's really cool, and they didn't do any of that. And it took me literally until I was like somewhere in my mid 40s to realize that is that how we see each other goes both ways. And so we want our family members to see us in a certain way, but that goes the other way too. And what I really had to figure out is that my parents are like Depression-era people. They don't talk about their sex, so they certainly don't want to talk about mine. They've never had sex, and as far as they're concerned, I've never had sex either. So that's the world they live in. And to them, that's acceptance. And it took me a long time to get my head around that. And so I think that's something that we have to be more open to as well, is we have to really define what it is we want and know that maybe people aren't capable, not that they won't, but maybe they're just not capable of some degree of giving us what we want. Now, I'm not talking about like, family members who are hateful or discriminating or bigoted. I'm not talking about that. That's not okay. But what I am talking about is like in the case of like my parents, in their mind, they were accepting me fine, and just because they don't ever talk about stuff like that. So, and I had to get my head around it. So, I think in the last issue there was talking about relationships and dealing with relationships, and I've met a lot of people who transitioned after they were married and talked with them. And one thing that I've, and it's nothing's 100%. Sometimes the gender identity just isn't a good mix, for the couple. But a lot of times, too, I've also seen that there's not enough communication when the transition is occurring that could have made an attempt to salvage that relationship if it was possible. You know, we really have to communicate more. And that's just the way for every long-term relationship. You know, a lot of times we put relationships on autopilot, and that's, you know, we really have to communicate more. That's what keeps relationships enduring. You know, the person that you have chosen to live with has to be more important than the phone and, you know, whatever Facebook Messenger or crazy cat video is going on at the time. So it's really about communicating. And if you don't feel comfortable communicating, hey, guess what? There's lots of people that can help you communicate better. You can either buy a book or you can go see a therapist, but there's lots of ways to learn how to communicate better. So you don't have to do it on your own. You don't have to have all the answers. You just have to know where to seek. And then the same thing as workplace issues. You know, it's really important to, you know, and luckily now we live in a world where we have organizations like HRC back in the back there that provide us with information about companies who are fully inclusive of the transgender experience. And so, you know, I always recommend and a lot of those companies are here in Central Florida. So I've always recommended to people, go and look at the HRC Equality Index on their website, find those companies, and, you know, and think about seeking employment in organizations that you know tend to be transgender inclusive and friendly. Why waste your time on a company that isn't so? I mean, there's a lot of viable employment opportunities for companies who are. And it's just going to make your life that much easier. So I talked about passing and stealth, and, you know, and also, you know, I think recognizing the insidious nature of shame. You know, shame is that little voice in the back there that never really quite goes away, that tells you you're not good enough, you're not smart enough, you're not, well, you know, you're not whatever enough. And just kind of instantly kind of nags all the time back here. And some days it's stronger than others, and some days it's barely even noticeable. But perhaps for a lot of us, it never really goes away. And, you know, and the goal, I think, through my own research and my own self-discovery is perhaps not to have it go away completely, because I don't know that that's possible, but to be able to manage it and sit with it and not let it rule your day. And so that's kind of acknowledging and being able to deal with it. So, all right, I want to go through these since how many actual behavioral health providers do I have here in the audience? 1, 2, 3, 4, 5, 6. Okay, 7. Okay, so about half. That's good. So I will. So then I'll lightly go through this here. So what I've kind of looked at is kind of the major modalities of behavioral health intervention and kind of what the pros and cons of using each you know, major modality for patients. So the psychodynamic is that it gives clients who are disconnected from themselves, they can gain insight and understand their inner workings. But the tendency on focusing on why a person, oh my God. So see what, I haven't done this slide in so long. Look at that, big mistake. Transsexual, yeah. So proofreading is your friend. So tendency to focus on why a person is transgender is not a popular approach with clients, especially when we talk about conditions being early life conditions or early life experiences causing things in our later in life. So the humanistic model is good for self-discovery and developing an understanding of what it means to be male and female, which I think is something that's very important. How individually you experience maleness or femaleness or somewhere in between. But the cons are lack of specific problem-solving approaches and directive interventions that can still leave clients confused and unmotivated. And then cognitive behavioral helps clients understand the relationships between thoughts and actions and results, but the focus on problem solving may not alleviate emotional scars. And then the biological is, of course, clients like the brain-based medical condition approach as it distances them from mental illness, but it lacks education and understanding about all the emotional and psychological impacts of being transgender. So over the years, I've kind of developed what I consider to be a coaching model. It's very solution focused. We look at what are your chief concerns, what are your problems. You know, let's problem solve our way through them, and just very action oriented for people. Also, I really more and more over the years, I started to look at all my clients through the lens of trauma informed therapy. It's very hard to not work in our community of anybody who's LGBT and not see some level of trauma somewhere. And then when the Pulse nightclub shooting happened. So our organization is one of the leading organizations that provides most of the relief and recovery to the Pulse-affected community. And trauma is rampant in our community, rampant. And so I always really started to look at, and multiple layers of trauma. You know, stuff that started very early, and then and just more things happen and happen, and just layers and layers and layers and layers. And, you know, and it's so complex for us to work through. So really starting to look at that through that lens. I also really started to look at, you know, I kind of became like a sort of a Buddhist and was looking at, you know, Buddhist teachings. And then I thought, oh, so check this out. So this is kind of funny. So I thought to myself, because I was always kind of, you know, if you ask any therapist, if you ask most therapists, you know, what's your theoretical model? What are they going to say? Yeah. Back in my day, because I'm, you know, old, we called it eclectic. So I didn't realize we called it integrated now. See, because I've been out of school a long time. But so eclectic, right? So, but I always kind of had like like a Freudian slant, you know, to just a little bit of a Freudian slant to my approach in working with clients. So then I started to think about Buddhism and Freudianism, and I thought, wow, there's some like similarities here. And I started to look at like the connection of how you could kind of create like a therapeutic model, integrating some of the Buddhist concepts and Freudian psychodynamic concepts, and I was like, oh my goodness, I've created a therapeutic orientation. I'm going to be famous. And then I found the book by Eric Fromm called Psychodynamic Buddhism that was written 150 years ago. So it was a really fun moment, though, for me. So a lot of psychoeducational. In my practice and now in our clinic, I developed what I call a readiness to transition survey. I've always been very sensitive to the idea that we're not gatekeepers, and what I really wanted to give clients was a didactic approach to these are the logistics involved in transitioning, and I wanted you to be fully aware of everything that you're going to encounter, the finances, the social impacts, having a work transition plan, coming out to people who are important to you. And I made kind of a little scale that's like your self-report that people, and really what it does, it's not to prove to someone whether they're trans or not. It's really to open a conversation about logistics and about what needs to happen in order for you to feel really prepared and successful. And then, of course, what I was talking about earlier, the identification of fear, shame, and resentments, and really developing hope. You know, I mean, so many clients come to our offices and they're without hope. And if we can leave them with nothing, hopefully we can leave them with a little bit of hope. So, community resources, PFLAG is really an amazing resource. And the thing that I love most about PFLAG, and especially directing parents of trans kids to PFLAG, is that I will tell them, I want you to understand that when you walk into that room, you're not going to get a finger pointed at you, and they're not going to say, you need to get okay with this. What they're going to tell you is, I know exactly how you feel. Come sit down. Let's talk about it. So it's not going to, yes. Absolutely, because if you go in there and the presentiment is that you got to change, then your defenses are going to go up and you're never going to grow. But if you go into the circle and people are like, yeah, come sit down and let's talk about it, then you can start to be open to growth. And so that's why I think PFLAG is so amazing. HRC, I already mentioned them, especially for their work in the Equality Index, and then the Transgender Legal and Defense and Education Fund. So let me tell you this. If you remember nothing else about community resources that I've talked about today, remember this. FloridaNameChange.org, a group of very dedicated volunteers spent unbelievable amounts of time to create the best website on this issue that I have ever seen. It is so user-friendly. It absolutely walks you through every single aspect of any ID that you need to change, whether it be your birth certificate, your gender marker, your passport, your driver's license, and it gives you step-by-step instructions with fillable forms, and then you put in what county you're in, and it tells you exactly what to do in your county. It is a extremely, extremely valuable resource, and it's all free. The National Center for Transgender Equality, and of course WPATH is the medical standards by which we operate as health professionals. And there's some books there. I haven't updated the books list for like a long time, so these are all you know, kind of classics now. But there's, you know, you can go to Amazon and there's tons of books. Yes. Yeah, so what I can do is if you want to come up and get my card after the presentation, then you email me and I'll send you the PDF. And then also, you know, I think, so the other thing too is Google is your friend. You know, so now we live in an age where we can find a lot of really good information on Google, and so I think we should use that. You know, don't expect people that you know that are trans to be the spokesperson for the transgender experience. Not everybody's down with that. Some people like to be able to share their stories, they like to be able to talk, they like to be able to advocate through their voice and their stories, but not everybody. And so it's really important to not assume that because you meet someone who is trans that they are interested, especially in that moment. Maybe they're like, you know, I got to get to like a pizza appointment or something. I don't have time to, you know, to educate you. So, you know, people got stuff going on. So, you know, you can't always assume that someone wants to educate you on that experience. And so there's a lot of really good resources that are real and accurate that's on Google. Correct. Mm-hmm. Everybody's different. Yeah, everybody's different. So we talked about the medical procedures and the HRT. I mean, really, it's just really about, I think, that just in terms of, it's important to know, you know, I told this story about getting the PhD. You know, it is well known, it is well documented, and at least some marginal studies that were done by Dr. Bowers and Dr. McGinn, that there's typically after a major gender corrective surgery, there's a depression that happens. And again, it's really about all of that energy is looking for a place to go. Absolutely, it's a benchmark. You know, it's really going through any type of big benchmark. Not necessarily the loss so much, but a dramatic change where you've got to a place where your life is now dramatically changed. That you know that you had been planning on for so long, and then you get there and now it's done. So all that energy has to go somewhere, and if it doesn't have a where to go, it results in depression. Um, So, other medical things to think about, which are very important, is that a trans female will still have a prostate, which requires health monitoring throughout her lifespan, and a trans man will also, a lot of times, have female genitalia, which will require health monitoring throughout their lifespan. Also, trans men are more susceptible to cysts in their female genitalia. They're more susceptible to breast cancer. So these are things that are extremely important to know. Lesbians are more susceptible to breast cancer too. And so, and the other problem for trans men is that, you know, if they, so it's very common pre-surgery to bind, so that you provide the perception of a no chest. But binding is actually not really very good for your health. And, you know, and it really makes it hard also to keep up a good exercise routine because you can't breathe if you're bound. But then some guys, they don't want to exercise unbound, and so it can be really problematic for trans guys. And then we were talking about the blood issues earlier. You know, all of this is all related, and so it can be, you know, so it's really good to have a medical healthcare professional that really kind of can take all of this into account and help the patients make the best decisions for their health. You know, and really maybe even work out a plan of how to get top surgery so that you don't have to bind. Binding is not really that healthy in the long term. So two things that trans people typically avoid at all costs as medical providers in public bathrooms. And medical providers are simply because a lot of times there's just assumptions made or statements are made. There's just not enough broad knowledge by general medical providers, and they'll say something that is, they'll say something or do something that is just kind of off-putting, if not downright discriminatory. Sometimes on purpose, sometimes just by ignorance and omission. But it doesn't hurt less. And so it can be very embarrassing, and people just not want to be in this space. And then public bathrooms, obviously, I mean, we know all about that. It's the whole fear of, what's going to happen to me in a bathroom, and which is such a shame that we have so much of that mythology. Let me tell you the story. So in the building, because I want to wrap it up really quick because I'm hungry too. What? Yeah. So in the professional building where Two Spirit is in downtown Orlando, so it's a 4-story professional building. We're on the 4th floor. Traditionally, all of the restrooms in the building were locked. And so at one point where I was still like a private practice that I had on the 2nd floor, I called the building manager and I go, "Why are all the doors locked?" And I knew the answer because, and I'm pretty sure I was still right, because the answer was they were trying to keep the homeless people out because we're in downtown Orlando. That's the answer. The building manager says to me, "Well, one time many years ago, a woman walked into the women's bathroom and there was a man in a dress that was in there, and she felt like she was unsafe and she was going to be insulted, and so we locked the bathrooms ever since." That didn't happen. And when there was so much hullabaloo a couple years ago about a man in a dress in the women's bathroom, I decided, because I went where do I go when I need information? I went to Google, right? I did the research, and I Googled every single possibly thing that I can. And I have a research degree, so I know how to get good information out of Google. How many instances have there been of a man in a dress in a women's bathroom that attacked women? How many did I find? How many? 0, because it's never happened. It's never happened. In the history of our society, it has never happened. At least not documented, but it's probably never happened. And so we have this ridiculous mythology all built up that is really causing psychic crisis for for our patients. For what? For no reason. And it's awful that happens. Yeah. 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 I know, it's really weird, right? Why it's like, I don't know. So I was thinking like several years ago that I was going to I wanted to get a T-shirt campaign that it's not about perversion, it's about peeing, because really the only reason why we want to be in a public restroom is to pee. How many people love public restrooms? How many people want to hang out in public restrooms? What? That's just crazy. And I'll tell you what's more is that I don't care the size of the public restroom. I want to be in there by myself. I don't want you to come in at all. I don't care what gender you are. I want to be in there by myself. And so it's like, I'm like, doesn't most people feel like that? It's just kind of weird to me. But anyway, back to the presentation. Being a culturally competent provider also means, it really means asking questions rather than making assumptions. It's really important that we ask people about their experience rather than making assumptions about who they are. And ta-da! Time for lunch. Does anybody have any questions? We have about, so lunch is at 1, it's 1:45, but I can certainly take a few questions, or, we can do whatever.
I would add, there's a really great article that I read probably about a year ago talking about the restroom issues that goes back into the history of why we have sex segregated restrooms in the first place. And it all came back to women entering the workforce, entering the workplace, and that the men in charge thought they needed to create a space for women that was plush and luxurious and safe. And so it's interesting how you sort of started with that. The idea of women in the world, and the restroom issue is right from that too. Yeah.
So also, if you are a licensed behavioral health provider, make sure that you give me your name, your email, and your license number on the pad in the back so that I can put your CEUs into whatever we call it. Yeah, CE broker. I don't know why my brain was. So I can put your CEUs into that. So it is.
Yeah, I have a question. So at work, I've noticed, so probably the first time you have this kind of crisis with parents with a child in terms of working through gender identity, and the second time I think this happens is Halloween. And what is the time, or certainly one of the next, what the Halloween costume and making sure Halloween costumes are, trying to find Halloween costumes that don't fit into this very binary kind of framework. One of the things I noticed at work, we have during Halloween we have this moment where um, employees will bring their kids in, and they can bring their kids in to get candy, and they've got their Halloween costumes, and they run all ages. We had this one photo booth area where it was like masks on a stick. They were just, you would just take that and they would stand and they would take their pictures. And they were a series of masks that you really couldn't, identify them as one versus other, except for this one that was clearly a Batman mask, right? It was the cowl with the.
Yeah.
Other than that, the rest of them were hard to identify as anything. And so the parents would come in with the kids and they'd go up to the masks, and the girls could pretty much pick any mask. But if a boy picked any mask other than the one that was clearly identified as the Batman mask, then the parents would say, no, 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 you don't want that one. It was interesting, this, like, because, it was the first time I ever sort of like in a Halloween setting seeing this thing play out at work, and it was just, so are we in a time in which there is a hypersensitivity to cisgender, hetero parents and children and what they're wearing or how they're presenting? It feels, I don't know, to me it feels like there's a hyper angst out there, and is that a thing, or is that just?
I think that there's always been gender oppression in history, and so much of it is subtle, just like what you've described, where we don't think that we're instituting gender oppression, but we are. We're sending young people very subliminal messages about their right to be certain, to present in certain ways, and that has a very pervasive effect on young minds. And I think it's always been. I think that we've always had that in our society in some ways. Any other questions?
I think it's helpful just to kind of get your message across because maybe it's not even intentional sometimes, you know? And
Absolutely.
so to
I think
say
a
that
lot of it is
you don't have
unconscious.
to do this, you think about what you're doing. You don't have to choose. You can let them choose.
Yes, I think a lot of it is unconscious. Some of it is, just
I
handed
mean, it
down
depends. Right,
bigotry.
right,
But
exactly.
some of it, like I think in that regard, we're so subtle. I think it's unconscious. All right, well, thank you all very much. We'll see you at lunch, and have a great rest of the conference today. Thank you all for coming to this conference. The organizers worked very hard to make this happen, so we owe a great debt to them. Oh, thank you.
Yes, big thank you, Dr. Dave. Thank you very much. And if you need to sign for the CEUs, please come see me back here, and we'll see you after lunch.